or a career in medicine. And these include skills that you can start to gain or continue improving as you go on through your high school and middle school years. So as we go over an overview of skills, these are skills that the AAMC, so the Association of American Medical Colleges, have laid out in what they call the core competencies of medical students. And these are what they listed as 15 traits that a medical student should possess. And they split up this list into three groups, so that's easier for students like me and you to understand. And those are pre-professional competencies, thinking and reasoning competencies, and your science competencies. And most medical schools require their students to have these qualities, and some of them are like personality traits, like some of your pre-professional competencies, and others are knowledge-based, like science competencies that you'll gain in some of your science classes. And it is always good to start developing these skills very early on, because whether they're knowledge-based or not, you can gain a lot of experience that can help you strengthen those skills. And here are your pre-professional skills. So there's 9 pre-professional competencies, and they're split into service orientation, social skills, cultural competence, teamwork, oral communication, ethical responsibility. So that applies to ethics with yourself and to other people. Reliability and dependability, resilience and adaptability, capacity for improvement. And many of these skills are things that you can also list on your resume. So in the future, when you're applying for jobs, those can also be really useful as you turn in your resume and you're looking to find like future employers. And many of these skills can be gained through volunteering opportunities. So there are lots of them here, like in SF for high schoolers and other experiences. So service orientation is very closely related with social awareness. And it's defined as the ability to recognize and meet a customer, or if you're working in healthcare, a patient's needs, regardless of if they are your assigned customer or patient. So, for example, like if you're working in a hospital, it's good to have like the ability to recognize what your patient needs, but in addition, like what other patient needs are, even if they aren't like specifically assigned to you. And this can include anticipating, recognizing, and meeting other people's needs and wants. So that also applies to relationship management. So like social relationships with coworkers, and other people, and bonds between them. So service orientation includes the following traits: empathy, so like understanding where other people come from; adaptability, so being able to adapt to different situations; communication, so being able to communicate effectively with other people; and trustworthiness. So like you need to lead ethically, so like we mentioned before, ethics, and build integrity. And knowledge. So that includes like having knowledge like with yourself, but also to know where to go when you don't have the answer and to be okay with not knowing the answer. And then we have social skills. So demonstrating strong interpersonal skills can help you accomplish career goals, and expand your professional network. So being able to communicate effectively, that can help you build, maintain, and grow relationships with your colleagues and in a hospital setting with your patients. And they can be an advantage by allowing you to like provide mutual support to other people and also gain more personalized feedback and referrals. So that's really important, like as you're applying for colleges and going forward applying for medical schools, because being able to have good social skills and bond with like professors or mentors can really help you gain like a very personalized letter of rec or like feedback, and then also like referrals to different programs. And social skills include the following. So effective communication, being able to like communicate what you want and what you need. Conflict resolution. So really being able to like know where that problem comes from and how to solve it. Active listening, empathy, and respect for the other person, and relationship management. And then we have ethical responsibilities. So ethical responsibilities apply to all fields of work, but in medicine and nursing, it's like especially important and also very accentuated in your classes. So for example, a lot of nursing majors will actually take a class that's the ethics of nursing. They have a textbook on it, and it's basically like the ethics of what nurses do. And the definition is demonstrating high standards of commitment, responsibility, effort, and reliability. And those responsibilities will include like commitment to your patients, self-determination, informed consent, competence in your field, and like for conflicts of interest, avoiding conflicts that like interfere with professional discretion and personal judgment. So that can also be like really important in like a medical setting because you have lots of professional discretion and being able to like keep things discreet. And also privacy and confidentiality, which also goes with conflicts of interest. Um, yeah, and then the nursing code of ethics will also exist, so you can read through that too. Reliability and dependability are also important in a workplace setting because it demonstrates that you take responsibility for your actions and that you're honest with others. So that, like when you're putting this on a resume or any application that you're putting out there, it looks really good to employers. And it's equally important in school settings as well. So in healthcare, with like the health and the lives of your patients in your hands, your employer will want to know that you fulfill obligations and you can follow through on commitments. So to know that you are a reliable person who can be there when asked, and have attention to details or be very detail oriented. So you can catch errors that you or others have made and be able to correct them, even if they're small mistakes or if they're like really big errors. Um, and to comply with organizational rules, policies, and procedures. So if you work in a healthcare setting, there's going to be lots of different procedures that you need to follow. And you can follow written and verbal directions carefully. Resilience and adaptability. So resilience means that you are able to bounce back, and adaptability means that you are able to like change under different conditions. So in healthcare, like resilience and adaptability are needed to provide adequate care during times of crises, like the COVID-19 pandemic, but also like epidemiologists and other places where there are lots of different diseases and viruses. So there are ways to strengthen these skills, and some of them are just kind of trying to change your mindset. So you should try to think of challenges as opportunities, to grow and learn, and of course to learn from your mistakes. And of course, following a healthy schedule. So compromising your health can slow both of those skills, and compromising your own health can make it hard for you to work in a healthcare environment. And planning and organizing your work so that can really help increase your productivity and really clear time from your schedule for any new circumstances that may arise. And then we'll move on to thinking and reasoning competencies. So there are four thinking and reasoning competencies that are laid out by the American Association of Medical Colleges for medical students, and those are critical thinking, quantitative reasoning, scientific inquiry, and written communication. And these skills can be gained at school and throughout your studies. So critical thinking is a skill that comes up in a lot of your classes. So like, for example, lab analysis in science, or looking at a problem from different perspectives in math, which comes up a lot if you're in advanced mathematics and you really need to think of a problem from different like points of view. And it doesn't also have to be like in your STEM classes. For example, you could be analyzing texts in English and thinking about them from different points of view and different ways. So the definition is to use logic and reasoning to identify strengths and weaknesses of alternative solutions, conclusions, and approaches to problems. And when you're applying to medical schools, they may ask you questions that test your critical thinking, like to describe a situation in which you used logic and reasoning to identify and weight alternatives and arrive at an approach or a decision or conclusion. So basically, like in a situation where you use your critical thinking to find a good decision to make or a conclusion. And what factors like do you consider and prioritize when you think over different approaches to make sure like they know that you're really thinking about your different solutions critically and knowing how to choose the best one? And how do you anticipate applying critical thinking as a medical student or practitioner? And critical thinking does come in a lot during a job in the healthcare field. So it's really important that the skill is strengthened, especially in school and training to be a medical professional. Okay. And then these skills for quantitative reasoning. can be developed in your math and statistics classes. So you can take statistics in high school. I think a lot of classes uh, locally offer it as an AP or an IB class. Um, but it can also just be developed in mathematics. So the definition is to understand mathematical facts and concepts and be able to apply them to real world scenarios. So that's what you'll mostly be doing like in math with word problems. And some medical schools might ask you questions like to provide a brief explanation of how you've used quantitative reasoning to describe or explain or understand like a natural or complex phenomenon. So how have you used like math to that you've learned in different classes like science approach to understand and explain that phenomenon? So is there something that that might weaken that concept? Or what ways will it strengthen that concept? And then, of course, scientific inquiry. So scientific inquiry can be developed in your science classes, and those include like labs and also reading through your textbooks. So the definition is to apply knowledge of the scientific process to integrate and synthesize information, as well as solve problems and formulate research questions, hypotheses, and know the languages of science and use it to explain how scientific knowledge is discovered and validated. So that's a really long definition, but basically just to like use the scientific process to create your research questions and hypotheses. So like you might have learned about like the scientific method. So to know the language of sciences, that's a lot like scientific literacy and understanding scientific research papers. And then be able to use scientific inquiry to explain how like knowledge in STEM fields is discovered and how to justify it. And some medical schools can ask you questions like to provide a brief description of how you've applied the scientific process in your research. And that can be like clinical experiences or even like experiences in your science class, or to discuss how you develop questions and hypotheses, how you use that to collect information, and then how you contributed to that body of knowledge. So that can also come up in like a PhD when you're defending your thesis. Like how did you develop your thesis and how did you contribute to the body of knowledge that you're trying to earn a PhD in? And then of course, written communication. So written communication can be developed in your English classes or on your own when you can hone on your reading and writing skills. So the definition is to effectively convey information to others using written words and sentences. So that also comes up a lot in healthcare because you're writing a lot of reports and things to your patients that need to like communicate effectively, like what they need to do or if there's anything they need. And some medical schools might ask you questions when you're applying, like to describe a situation in which you conveyed information effectively through writing. So, like, who was your intended audience, and how did you like tailor your communication to fit that audience? Because communication can vary differently by how you think your audience will accept it. And how do you know that like your communication is effective? And then finally, we have our science competencies. So there are two science competencies that are laid out by the American Association of Medical Colleges for medical students, and those are knowledge on living systems and knowledge on human behaviors. And those two subjects will also come up in your MCAT. So as you're taking the admissions test to apply to medical schools, you'll also need knowledge on these two competencies. So it's really similar to thinking and reasoning competencies since they can also be developed in school. You can learn about living systems in your biology classes, but if you want to, it's always good to study on your own and gain knowledge early. And human behavior is more of a personal competency, but it can also be achieved through volunteering at different places. So living systems is knowledge that can be developed in your chemistry and biology classes. And this definition is to apply knowledge and skill in the natural sciences and solve problems related to molecular and macrosystems. So those include like systems that are inside molecules and outside of molecules. And those include biomolecules, molecules, cells, and organs. So some medical schools might ask you questions like provide an example of how you approached a problem related to living systems. So like what knowledge and methods did you use to solve the problem? And how did you gather additional information about it? And how do like your different approaches to like problems help demonstrate creativity and systems thinking? And then we have human behavior. It's more of a personal skill and it's not as easy to develop in a classroom setting. And it can be developed through volunteering. So you can kind of fit that with your pre-professional competencies too. And the definition is to apply knowledge of the self, others, and social systems to solve problems that are related to psychological, sociocultural, and biological factors. And those factors also influence health and well-being. So, like, how did you apply knowledge about yourself or other people to solve problems that are really related to people's like psychological, social, cultural, and like biological things that can influence their health? And some medical schools can ask you questions like to provide an example of how you approached a problem related to human behavior. And that can be like in your own life or through like the academic analysis of a different issue or a problem. And like, how did your understandings of social structures and determinants of health like inform your approach? So how did like knowledge, your own knowledge of different social structures and different parts of health help you decide your approach? And then like, what are the challenges and opportunities of taking a holistic view to health and well-being? Okay, so we've covered all of our competencies. Do any of you have any questions?